was rehearsing.
Every Wednesday at 7:30 p.m. Spotlight.
Do you feel that they are in a place where they can effect a Barack Obama moment?
When you hear the word of God and you hear Jesus is speaking,
Real talk on real issues.
You know, the Bible says faith without works is dead.
The truth of the gospel that will survive the time is not a health and wealth gospel.
When there is time to harmonize and bring one composite amendment.
With idealistic, thought-provoking guests.
So people come to be serviced, to be encouraged, to be empowered.
When the storm is over, you desire the closeness you have with God.
Hosted by Reverend Edward Furi.
Good evening. We have all experienced a common cold at one time, or perhaps you have it right now as we speak. The symptoms may include coughing, sneezing, running nose, sore throat, amongst other symptoms. But what differentiates a mild chest infection from a severe one? What conditions are termed as chest infections? Joining us tonight on Health Check is Dr. Peter Munyu, a pulmonologist, or you can call him a chest specialist, ready to answer all your questions regarding chest infections and any related question that you may have. You can start sending in your questions relating to our topic of the day today about chest infections. Our SMS line is 22232, that is 22232, starting with your name and where you're watching us from. Remember, you can also stream us live on Facebook and YouTube via the handle at Hope TV Kenya. Good evening and welcome to Health Check. My name is Grace Matisse. I hope you had a great day and that the Lord has kept you well, and we are glad that you're tuned in tonight. Allow me at this point to invite Dr. Munyu. Good evening, Dr.
Good evening, Grace.
How was your day?
My day was quite interesting with the inauguration.
Yes.
Very colorful ceremony. It was a good day.
But you still had some clients coming in for checkups.
For a few hours, of course, you have to go and see one or two patients,
yes,
so that you make sure their day is also good.
Yes. Let's begin by defining a pulmonologist, such a big term. Break it down in short. Who is a pulmonologist?
A pulmonologist is essentially a doctor who deals with problems involving mainly the chest. This will be the lungs and the structures that support the lung, the airway. We are also talking about the upper airway, that's the nose, ears, throat. We share that area with the ENT surgeons. So that is the area that we will handle. And that's what a pulmonologist is.
A lungist.
A lungist.
A lungist, a new term.
No, it's not a correct.
Our own creation of this great day.
Yeah.
Okay, thank you, Dr. So let's begin by defining what is chest infection.
Okay, chest infection basically is an infection of one of the structures within the chest cavity. The chest cavity is composed of the outer structure, that is the ribs, the muscles that help us to breathe. On the inner surface of this structure, we have a lining which lines the inner surface of the ribs and the outer surface of the lungs. We call that lining the pleura. And in between there, one can get an infection. And then the main structures within the lung, within the chest, that is the lungs. Supplying the lungs with air is the airway. It starts at the neck, we call that the trachea, coming down to divide into the bronchi, and continues dividing into smaller and smaller branches. So any of these structures can get infected with different types of germs, whether they are bacteria, viruses, or fungi. Even parasites, some other types of parasites may affect the lung to lead to a chest infection.
Okay. Now that you've mentioned different things can, cause that chest infection. Let's now break it down to what are those that causes chest infection.
Yes, chest infection, for the longest we have said that lung infections are caused by bacteria. But as science has grown, we've identified other germs that may cause a lung infection. Recently, we've had the COVID infection, which affected many people.
Yes.
That is one of the viruses that affect the lung. Another common virus that affects the lung is the influenza virus. Then we have other germs like the tuberculosis bacteria, which behaves differently from the usual bacteria in that it is more difficult to treat and takes a bit longer to cure. And then for people who have some conditions which reduce their immunity or their ability to protect the lung, we may have germs called fungi, which may get down into the lung and cause specific type of infections. We are able to determine what infection is affecting the person by assessing either the lung tissue or sputum, so that we can try and identify under the microscope or try to grow the germ in the laboratory. And lately we have got what we call molecular tests. These are tests which look for fragments of the germ, whether it's the genetic code or fragments of the outer layer of the germ. So those are called molecular tests.
And Dr. you've mentioned about some infections are caused by bacteria, others by fungi. You mentioned COVID.
Yes.
COVID is so real. Because it was here with us the other day.
Yes.
And you're able to tell, this is caused by COVID. So how do you identify that you have a chest infection caused by a bacteria, and what happens, for one to identify that this is a bacterial chest infection, this is a fungal chest infection, this is a molecular chest
and
infection.
A viral maybe.
And a viral, yes.
Yeah, the first thing we look at is the history. We call that diagnosing a lung infection.
Yes.
And the first thing we look at is the history. Different infections behave differently. For example, virus infections, frequently will start as a cold before the virus goes down to affect the lungs.
Like a common cold?
Like a common cold, yes.
Okay.
If a common cold is caused by the virus we call influenza, amongst many other viruses, the patient will frequently present, I had a running nose, I had a fever, joint pains, muscle pains, and of late I'm now having cough, I'm having difficulty in breathing, fever has persisted, chest pain. So those things help you. And then frequently the virus infections are of short duration, a few days, compared, for example, with the tuberculosis, where the person will come with a longer history. Maybe they have coughed for 2 weeks, 1 month, 6 months. Some people even come having coughed for a long time. But because the disease was not very severe, they may not have sought care early. Or because the disease was not causing any limitation, they're still able to go to work. Maybe they sweat a bit at night and have fever at night, but during the day they are walking around. And so the disease takes a bit longer. And then there are characteristics which we find in such kind of illnesses, such as a person who have lost weight. They have other changes, you see, like when they cough up blood. So now the history will help you determine this is most likely a virus infection, or this is most likely tuberculosis. And the same things that we ask in history help us determine, this is not likely to be a bacterial infection, a viral infection is most likely to be the usual bacteria. That is why when you see a doctor, please give as much history as you can related to the conditions. And then there are things we call predisposing factors.
Yes.
For instance, if someone has a certain disease which reduces immunity, let's say HIV, diabetes, cancers of different kinds, there are certain types of germs which will affect them compared to that person who has competent immunity.
Yes.
We also look at extremes of age. The children have their own groups of infections, and the very elderly people will have certain types of infections affecting them compared to people who are in the middle part of the life cycle. That does not mean that a very old person cannot get the other types.
Yeah.
But when you take a history, you look at the patient, they are more likely to have certain groups of diseases compared to maybe a younger person. Then we go to the next step where we do different types of laboratory and radiologic examinations. When we send blood to be tested, there are certain cells which will increase in certain types of infections. For example, if one has a virus infection, there's a certain group of cells which will increase compared to, these are called lymphocytes, compared to a person who has a bacterial infection where a certain group of cells will increase called neutrophils. So these are clues which may help you determine most likely I'm dealing with a virus infection or a bacterial infection. But these are not universal. You may find a person with a bacterial infection who has lymphocytes. So you are also going to take the history, take the laboratory tests. You can't interpret them in isolation.
Yes.
Then you do your x-rays. And there are certain patterns we get in x-rays or scans which help us determine that this kind of infection is likely to be a bacterial infection. This appearance on the x-ray is likely to be due to pneumonia, due to TB, because TB also causes lung infection, and therefore TB is one of the causes of pneumonia. Or the appearance, for instance, with COVID infection,
Yes.
there are some x-rays or CT scans we could look at like this, and even before you've seen the patient, you can say, this patient has got COVID.
What was happening in the
In the x-ray, yes, there are specific changes which were occurring. We call them ground glass opacities. The x-ray normally looks dark black. But in a person who has a pneumonia, it becomes white, for example.
Okay.
But in people who had COVID, for instance, the white patches or grayish patches will be on the outside or the periphery of the scan. So even before you know the patient, you are shown an x-ray, you can with certainty say that this is most likely this type of virus.
Yes.
But I usually say diseases don't read books, meaning that a disease does not know that I should look like this. So even as we look at x-rays or blood tests and things like that, the history is very, very important, and what we find on examining the patient in terms of narrowing down the possibilities. Now we come to the other specific tests now, which will help me determine, is this a virus infection, is this a bacterial infection, is this TB? And this is where we do analysis of tissues. And here tissues, you are talking of either you are analyzing sputum or you are analyzing lung washings, because there are tests we do, we call bronchoscopy, where you actually put a tube in a patient's mouth when they are asleep,
Yes.
into the lungs, wash out the lungs, and suck that back and take to the lab. And the lab will be able to tell you that this is a pneumonia due to this germ. Occasionally, we may need to take a tissue of the lung, where we ask the radiologist or the surgeon to take the patient, take a tissue of the lung, and that is analyzed, especially with the parasites,
Yes.
so that you can identify the specific germ. Because if you give the wrong treatment, the patient will not get better. So we do have quite a number of approaches where we can identify the type of germ that is causing the infection. However, not everyone can get all these services. For example, if you go into some hospitals, they only have an x-ray and maybe they can do a blood test. They are not able to do sputum. So the first step is to assess what is the likely germ causing the problem. Sometimes we give what we call empiric treatment. If from the history, x-ray, blood test, we suspect that the patient has a bacterial pneumonia, the patient is not very sick, it is safe to give that patient what you call empiric treatment.
Yes.
You give them medicines which have been known to work for that kind of patient, rather than wait for 2-3 months while the patient looks for money to do a CT scan, they're still suffering. So you can give initial treatment even as we wait to do the other tests. And most patients actually get better with the initial treatment.
Yes.
It's only in a group or in a certain group of people where they have risk factors, either in the history or in the clinical exam or in the radiology, that you will want to do more testing. Most pneumonia is treated actually without much investigations.
Okay, thank you, Daktari. And before we get to, for you explaining to us what happens, you know, when you say somebody has a chest infection, you say it starts from the airwaves down, then to the lungs. Lungs, they are down there.
Yes.
But what usually happens, would love to understand what happens if somebody has a chest problem. Just to remind our viewers that we are live. This is Health Check. And my name is Grace Mutisa. I'm hosting Dr. Peter Munyo, and you're talking about chest infections. If you have any question or comment, our SMS line is 22232. That is 22232. You can also check us live on Facebook and YouTube. Check on the comment section and drop there your question or comment. We'll be getting to you in a short while. So, Dr. Munyo, so what happens for, you know, in the entire system, you know, when somebody is diagnosed to have chest infection?
Okay. The whole system you have asked is a very, very important aspect to look at.
Yes.
The question one would ask is, how come all of us don't get pneumonia? And the reason is, the system is designed to protect us. And people only get pneumonia if there is a failure of the protective mechanism. And the protective mechanism starts from the nose. If you look inside the nose, you'll find that the nose is not a straight tube. There are curves and corners. The curves and corners are meant to slow down the air. And you know, if you slow down the air, debris will fall, like dust and things like that. The nose also has hairs, which trap dust.
Yeah.
The nose produces mucus, which traps dust, traps viruses, traps bacteria. And that mucus is not just mucus. Inside it is a broth of chemicals which help us kill those germs. So if one has an overwhelming infection in the nose or the sinuses or the back of the throat, some of those infections may end up dripping down into the chest. If you come down to the neck, we also have reflexes like the cough reflex. Yes. Something tries to go into your airway, you cough your best, you're trying to throw that out. And then the airway also has got mucus. There are special cells within there which push the mucus upwards, so that if any germ has managed to escape the upper defense, gets down into the upper airway, or rather into the lower airway, the cells there are specialized to beat that mucus up, bring it to the throat, and you cough it up or swallow it, or it's destroyed. Yeah. So if there is failure of this mechanism, then a germ can end up within the lung. And if that germ multiplies, that's what we call a lung infection or a chest infection.
And it's amazing how God has created all these things there, you know, to act as guards.
That is true. We are wonderfully created. This is just the lung. We have defenses in the brain, we have defenses in the stomach and intestines. It's amazing. It's amazing, yeah.
And there are times, you know, I'm thinking at times when you have a cold, you say, I don't like this mucus, it's just too much.
Too much,
and
yes. It's doing something for you. Yeah, that's true. That's true.
Doctor, we appreciate you for that. So let's now go to the symptoms. What symptoms should one look out for to cause them to rush to the hospital for checkup to find out if they have a chest infection?
Okay. So if we are talking about children, the key concerns that will make one go to hospital is that these children will have fever, they'll be coughing, they'll have difficulty in breathing. Children refuse to eat, they are crying, you're wondering, why is this child crying? Some of them will have characteristic sounds coming from their chest. There's something we call a croup cough. It has a certain cough which doesn't sound like the usual cough. We have children who will start wheezing, that's a noise in the chest, so that you know there's something wrong with this child. In adults, they will complain of coughing, of differing durations. They'll be producing sputum, and some of that sputum may or may not be blood-stained, fevers, sweating. If the problem has gone on for a period of time, they may have weight loss, chest pain, and frequently the reason people come to hospital is because they are having significant difficulty in breathing. Yeah. If you experience any of these symptoms, please come to hospital so that we assess, is it pneumonia? Is it other things which look like pneumonia? Because the other conditions which can mimic pneumonia, you see things like asthma,
yes,
heart failure, bronchitis, all these things can mimic pneumonia. And therefore, if you find these symptoms have gone on for a day or two, or they are severe, please seek help so that the proper diagnosis can be made and you get the proper treatment.
Still going back to children,
yes,
you know, for parents who are watching, that means you really need to be keen to watch out your child. And you had mentioned something before, Daktari, about on the back of the throat. You know, maybe something happens there that you need to watch out for. What exactly?
Okay.
Yes.
So the things that may happen there, you know, some children when they get infected, they develop tonsils. And if you look at the tonsils, they may be having pus. And if this child is not able to protect the airway, the same germs will go down in the chest. So it is important if the child cannot eat well, is complaining, if it's an older child, they are complaining of pain when swallowing, it's important for this child to be actually checked so that we know what's going on.
Okay, thank you. So somebody may ask, is chest infection that serious? Is it contagious? You know, how does it spread? Do I need to put on masks everywhere? Because it seems the nose plays a key role in all this.
Okay.
Yeah.
Now, the lung infections spread through different ways.
Okay.
And what I know is that many people have learned through COVID how lung infections spread. Now, one of the ways in which lung infections spread is by airborne. That means I cough, the virus or the bacteria is floating in the air, and when you breathe in those germs, and they end up in the lung and cause an infection. The other one is by touch. For example, influenza. More influenza spreads by touch than by airborne. And how does this happen? I have influenza, I have a handkerchief, I keep clearing my nose. Those viruses are stuck in my hands. I meet Grace. Hello, Grace. She's my old friend. Yes. And then Grace goes on her way and feels some itchiness in the eyes and touches the eyes. Yes. Those viruses are just waiting for such a chance. They start multiplying in the eye, going to the nose, and down into the lung if she's predisposed to that kind of thing. Yeah. So good hygiene is very, very important. Hand washing, very, very important. Lung infections are not one infection. So different infections will behave in different ways. For example, if we look at TB, TB is airborne. And therefore, if we are staying in the same area for a long time, as happens in barracks, people are living in boarding schools, in the offices, you may find, I have had patients who work in the bank, they're living in one small cubicle. Yes. 5 of them, they are counting money or they are serving clients. One of them has TB, and within a few months, another one and another one. It's because they are breathing the same air. Yeah. So to prevent this kind of thing, we need very good hand hygiene. And you'll notice last year and the year before, our children were not getting so many colds. Yes. Even ourselves, like myself, I stayed for so many months without getting any cold because we kept washing our hands. We are using our masks. So the routes which these viruses and bacteria use are blocked. So it is very, very important. Even if COVID has gone down, the mask mandate is less strict now, we still maintain some of these habits like hand hygiene and good aeration in the houses and where we are working.
I think that's important one for employers.
They must hear this. They must hear this.
Space
yes,
in that office,
yes.
You know. What about in the house?
Yes.
You know. Some of us live in very small houses, you know, economy imekuwa ngumu that time, and we have to do the sharing and do that.
Yes.
How can we keep ourselves safe even in that space where that's the only space we can afford?
Yeah, it's true. Some of the things that we can do even if you're living in a small house, opening windows if it is safe to do so, making sure sunshine comes into the houses, making sure there is good ventilation in the houses, even basic things like airing your clothing, very important to prevent some of these infections. So whether you're living in a big house or a small house, there's still something you can do to protect yourself from these infections.
Okay, sawa. And now we've talked about how to, you know, like how to identify you have. So the treatment, how does that happen? Is it the same for this one was bacterial, or this was viral, or this was molecule? How's the treatment like, and how long does it take?
Good.
Yeah. You've mentioned, sorry, Doctor, and you've mentioned TB.
Yes.
You know, and what rings in my head, TB na tiba. Hakikisha umemaliza dawa, you know.
That's
it's like you have to take it for a long time and
Yes.
consistently.
Yes.
So how is the treatment?
Okay. It is very important for the doctor to try and identify the type of infection that is causing the pneumonia. There are some pneumonias which have excellent treatment, especially bacterial pneumonias. If we look at the viral pneumonias, most viral pneumonias do not have treatment. So what doctors will do is give supportive treatment in the sense that, is this person in pain? Cover the pain. Is the person dehydrated? Rehydrate the patient. Are they having difficulty in breathing? Give them some oxygen, and so on, so that the body gets a chance to fight this infection. Some virus infections do have treatments. Of the COVID, there are some medicines available to manage COVID. Similarly, infections like influenza do have an antiviral medication. The only thing is it has to be diagnosed very early, because if you wait 4 or 5 days, the efficacy of the medicine gets less. So that's why it's important. If one notices something that is not right, it's good to have an opinion of a doctor, not necessarily a specialist, just see your GP, so that they can see, is this something that needs this kind of treatment? When we go to conditions like TB, TB has very specific treatment. The medicines are used for at least 6 months. So one has to be sure that I am dealing with tuberculosis before you initiate the medicine, because you can condemn a patient who has no TB to unnecessary treatment. One word of caution is that we have noticed a lot of antibiotic misuse. My child is coughing, she has a fever, the first thing I do is get her amoxicillin or cotrimoxazole, many antibiotics, and unfortunately most of the pharmacies don't help. You can walk to most pharmacies in this country, you ask for any medicine, particularly antibiotics, and you get them. And possibly this child or this person does not have a bacterial infection. And therefore the antibiotics, which mainly work against the bacteria, are going to be useless. And all that we are doing is increasing something we call antibiotic resistance, such that if that person in future gets a bacterial infection, that bacteria is likely to resist that antibiotic that you use. So very, very important, even before you give our patients or our family members antibiotics, we have a degree of certainty that we are dealing with a bacteria. Because we sometimes find patients who have received antibiotics for 6 months because they have a pneumonia, and it is TB. And those antibiotics are completely useless as far as managing TB is concerned. Therefore, they end up with lung damage due to untreated TB. And if this person had sought medical care early, that diagnosis is not very difficult to make.
Yeah. Wow, important things there. And please remember, we are looking forward to answering your questions on 22232. That is 22232, or at Hope TV Kenya. Our topic for today is chest infections. That's what we are focusing on. And in a short while, we'll be having our break right here. Then we'll come back to answer your question. But before we go on break, Daktari, you've mentioned something very important, that if I notice something is wrong, I need to run to the doctor so fast, even just a physician, to check me out. If not, I might experience drug resistance. So at that level where there is drug resistance, what usually happens in a patient's life who is having chest infections? Yeah,
we struggle a lot with the drug resistance, especially in patients who have used a lot of antibiotics. And this will happen either in patients who are wrongly diagnosed. And when I say wrongly diagnosed, it's like that patient I've talked about. They have TB, but they have received course after course of antibiotic. The other thing is treating all coughs with antibiotics. And what happens is that the germs that are sensitive to that particular antibiotic die, and what is left is a group of germs which are resistant to that antibiotic. So should I end up with an infection due to those germs, then I will have a resistant germ. So what do we do about those patients? We deal with this frequently, especially in the intensive care units and the high dependence units. But we also find this even in the community, where a person walks in, they have an infection, but they have used so many antibiotics, germs have become clever, they have resisted all those antibiotics. The first step is to identify which germ the person is infected with, and we know that by either doing cultures or molecular tests. When we do cultures, the next step will be to expose that germ to different antibiotics and see which one works. It is a trial and error kind of thing.
Yeah.
You use this antibiotic, it doesn't work. So you do that trial and error in the laboratory. After you have identified the germ, you expose it to different antibiotics and see which one works. Now the tragedy is, for very many years, we do not have new antibiotics being made. So if the germ has been exposed to whatever antibiotics we have available, then you may have to go to either toxic antibiotics or very expensive antibiotics. Indeed, there are some antibiotics which will cost a patient maybe for a 7-day course 1 million shillings.
Oh, really?
Really, yes. So it is a serious thing, this thing of avoiding unnecessary antibiotic use, because it may end up being extremely expensive.
Yeah.
Yeah.
An
And the
antibiotic
cost
at 1
there-
million.
Yes.
And the way you know we live in a generation where you feel I'm coughing, you go self-prescribe, you
Yes.
know, and the pharmacist will just give you go 1 times 2. You sort yourself out, not knowing that if the body resists, it's a done
It's a
deal.
problem.
You need the extra cash for that.
And you know the problem with that habit of going to the pharmacy, you get an antibiotic, you come out, you get well.
Yes.
Now that reinforces that, it works, man. It works. When I go to the pharmacist, it works.
Yes.
Unfortunately, what may be happening is that probably you had a virus infection, which your body was going to clear anyway. So the moment you take that antibiotic, you start feeling better, you assume, the antibiotic must be working. So the next time you go and get an antibiotic, and unfortunately, that time it is a resistant germ.
Yeah.
So the antibiotic, what will it do? It will make you delay getting a proper diagnosis. And then you are already infected with resistant germs. So it becomes very messy. You are suffering. I don't know how to quantify suffering in terms of money, but the antibiotic then, which will work, may be very expensive.
And you've mentioned, Daktari, that if it's a viral infection, it will clear on its
In most
on its
cases,
own.
they clear by themselves.
And you know, as a patient, I've been a patient, and you go to the hospital, you tell the doctor, and say, it's a viral infection. And then you'll be fine. And you're like, no, prescribe something. Tell us about viral. and just for those who are watching, and they're like, you need to give me something if it's a viral infection.
Yeah.
You know, psychologically to know it's okay. Yeah. Why do you say it will clear itself and I don't need any medication?
It's because you are very wonderfully created. In fact, when you find that you are going to hospital because you are unwell, it's because your usual method, your body's own methods to clear or mechanisms to clear the infection may have been overwhelmed for a short while, and therefore the inflammation is causing fever, is causing pain, is causing difficulty in breathing. If we can prove that it is a virus infection, the best thing to do is not start giving you antibiotics which work against the bacteria, but to give you supportive treatment. So if you have pain, we give you a pain medicine. If you have fever, we give you a fever medicine. If you're having difficulty in breathing, you get oxygen or other ways to improve your breathing. You remember when many people were getting COVID, majority of them refused to go to hospital because you come to hospital, Dr. Aero and his ilk will put you in quarantine, they will put you in isolation. We don't want that kind of thing.
Yes.
So many people actually got well despite not going to hospital because this was a virus infection. And our bodies are designed to fight virus infections. It's only in a few cases where the infection is so bad such that if it is already affecting your breathing, or if you're able to measure the oxygen level in blood, you find it's falling, then see a doctor, get it sorted out. Please don't make a decision that this is a virus infection and stay at home.
Yes.
Let a doctor or a nurse or a clinical officer see you, look at the situation, tell you that this is a virus infection, you don't need an antibiotic. Yeah.
Okay. Thank you. He's called Dr. Peter Mwinyu, a pulmonologist, helping us to talk about chest infection today. And your questions on 22232, that is 22232, or at Hope TV Kenya, that's where we are receiving all your questions at this time. I believe it's time to take a break, and we'll be right back to check out what you're saying on your questions and continue with this discussion. This is Hope TV Look and Live, and the program on air is Health Check.
Are you a talented youth between the ages of 18 and 24 years? The RAV. Can you sing? Can you dance? Wear Hutiafua mic or any other performances? The RAV. Auditions in Eldoret will be held on the 15th of September and in Nakuru on the 17th of September. The RAV is a chance to showcase your talent in music, dance, poetry, acrobatics and more, and stand a chance to win 300,000 shillings, a recording deal at Hope Recording Studios, and many more prizes. To register, send an SMS starting with #TheRAV with your name, county and talent to 22232. That is 22232 to get an invite to auditions happening near you. For more information, please call 0709-861-223. That is 0709-861-223. Or log on to www.hopemediakenya.org for details. The RAV. Identifying talent, inspiring passion. Powered by Hope FM and Hope TV.
We want to welcome you to the CITAM Springboard Missions Convention 2022 with a fresh anointing to radiate God's glory as we reach out to the lost. Join us at CITAM Valley Road from the 20th to the 24th of September 2022 from 2 p.m. every day. The convention is themed Till the Whole World Hears and will definitely revive and uplift your faith. Anointed speakers include, amongst many others, Bishop Callisto Odedi, the presiding bishop of CITAM, a renowned and passionate international speaker on the subject of missions. Dr. Sammy Wanyonyi, the founder and lead evangelist of Shine in the World Ministries, based in Minneapolis, Minnesota, USA, who has preached the good news of Jesus Christ to millions of people in North America, Africa, and Asia.
Yes, in this world of bad news, in this world of fake news, the gospel is more relevant than ever before.
Dr. Nelson Makanda, the General Secretary of the Evangelical Alliance of Churches here in Kenya, and Dr. Stanley Mukowe, the Director of Family Life Ministry at the Navigators in Africa and a highly sought-after speaker on family ministry, parenting, mentoring, and leadership development. Matthew 24 verse 14 tells us that this gospel of the kingdom will be preached in the whole world as a testimony to all nations, and then the end will come. Get ready and don't miss the Springboard Missions Convention 2022. Save the dates. Entrance is free. There is much more information on our website, springboard.citam.org. Spread the word and use the hashtag Springboard 2022.
Welcome back to Hope TV. This is where you look and live. My name is Grace Butiso, and the program on air is Health Check, and our focus today is on chest infection. What you need to know, how to take care of yourself so as not to get it. But if you have any, or you're experiencing any of those symptoms, there is hope, because Dr. Mwinyu is here and educating us on what we need to do. And in a short while, we'll be getting to your questions. Remember, our SMS line is 22232. That is 22232. You can also get us at Hope TV Kenya on Facebook and YouTube. We are live right there, by the way. Remember to share the link with all your relatives and your neighbors and your friends so that we learn together. And allow us, let's go and sample what she's saying on our SMS line. Dr. Mwinyu, let's begin with this one, who says, how is cold related to pneumonia or chest infections? That is Vicky from Upper Hill.
Yes, Vicky. Colds generally are virus infections. In most cases, our bodies are able to overcome the colds. But if the germ finds a person who has reduced immunity for whatever reason, or the germ is particularly nasty, it may occasionally go down into the lungs and cause an infection. So most colds are virus infections, and they can cause virus pneumonias or virus lung infections. So that's how colds can sometimes cause infections. But we must also remember that there are things which look and sound like pneumonia that are not necessarily infections.
For example?
For example, for people who have allergic conditions, they'll come saying, I have a cold, or our people like calling it homa.
Yes.
Because they have a running nose, they are feeling a bit feverish, and this is a response to allergy rather than infection. And when they have this kind of reaction, sometimes the allergy extends to the lower chest, into the lungs. For people who have asthma, they may also have allergy in the upper airway, but they also get asthma attacks, which affect the lungs. And this person will cough, you get easy fatigue, getting very easily tired, shortness of breath, and they will think that they have a pneumonia. That is why it is important. Google teaches us many things, but there are times when people have done disservice to themselves by looking, oh, I have this, I must have pneumonia. Let a qualified person assess and say, my friend, you have pneumonia. Please, it sounds like a bacterial pneumonia, and an antibiotic will help. Or this is a virus, upper respiratory tract infection. It will go by itself. Just take some warm water, some lemons for some people, and it will go. Take some painkiller in this particular case. So viruses can actually end up in the lung to cause lung infections, but not all colds are due to infections. Cold here in quotes, based on what I've experienced, people telling me I have a cold, and you do an assessment and you find that it's just very bad allergy. Yeah.
Okay. And you mentioned about pneumonia, and what comes to mind is bronchitis.
Yeah.
Hope I've pronounced it well, medically.
Yes.
Is there any relation, and what's the difference?
Okay.
And how are those two related to chest infection?
Okay. Now, bronchitis is inflammation of part of the lung called the bronchi. Bronchi are those tubes which carry air from the big tube called trachea into the different portions of the lung. And those can get infected, particularly with bacteria. So one can get an infectious bronchitis. On the other hand, one can get an allergic bronchitis, meaning that the airway is so sensitive to things that other people ignore. You see, like dust or perfumes, polish, paint, things like that, pollen. All those can cause an allergic reaction affecting the airway, the tubes called bronchi, and that can be an allergic bronchitis. So even when we think that the bronchitis is an infection, it is still important to have it assessed, especially if it is recurring, so that we can get the appropriate treatment. If it is an infectious bronchitis, we may need to use antibiotics, and the word here is may. We may need to use antibiotics, or we may need to use medicines to support until the body corrects itself. Or if it is an allergic bronchitis, antibiotics have no role. We use medicines against allergies and inflammation. So very, very close conditions, similar conditions, but the management is completely different.
Okay, thank you. One more question here from one of our viewers is asking, kindly ask Daktari, what causes persistent acidic mucus production, and how can you cure this condition?
Okay, that's an interesting one. Now, when we hear about acid, we think of bitter. And one can produce bitter mucus from two sites that are close to the chest. One is when people have a condition we call reflux, where they are actually getting acid from the stomach, moving up in the food pipe, ending up in the throat. And this mucus is acidic because the stomach generally is acidic. The other thing that may be happening is that this person may have changes in the airway, what we call bronchiectasis, where the tubes become a bit dilated more than usual. And when they are dilated like that, they have a tendency to get recurrent infections. And when the tubes, the bronchi are infected, mucus production increases, and that can sometimes be colonized by germs, which make it taste a bit bitter. So if, as she has said or he has said, this is a persistent problem, it needs to be properly assessed so that we know, is this arising from the intestinal system? Is it arising from the lungs? Because if it is arising from the intestinal system, it's a different way of treating it. If it's arising from the lungs, we find out, is it bronchiectasis, is it other things, so that the treatment is targeted at the underlying cause. In medicine, it's always very, very important to find out why is a particular symptom appearing. Because if you just deal with the symptom will persist. But if you deal with the underlying problem, either you clear the symptom, or you can advise the person, this is a problem you are likely to live with, it's not curable, but it is a problem we can manage so that your life, the quality of your life is okay. Yeah.
And for it to reach at that point where you say, now, my dear patient, this one, you're going to live with it for a lifetime, so you have to manage it and trust God for a long life. How does one get there? Is it that a patient assumed something or wrong treatment? Yeah.
It depends on the kind of condition. If we specifically today we are looking at infections.
Yes.
If an infection is either not diagnosed on time or is diagnosed and treated wrongly, then it can cause irreparable damage within the lung, and this damage can heal with scar formation. When scars form in the lungs, the tubes get distorted and we end up with the problem I was calling bronchiectasis.
Yeah.
This sometimes is due to the patient's own actions or inaction. For instance, the patient may keep buying antibiotics, while indeed they have a condition like TB. And the TB is relentlessly damaging the lungs, and therefore in the long term, the lungs get destroyed. Similarly, it may be a fault of the health system, whether it's the doctor or the nurse or whoever, in not either doing the right tests, either because they don't know, or they do not have the capacity to do those tests, or they have failed to refer the patient appropriately. And the same scenario ends up that the patient gets treatment which is inappropriate or inadequate for the condition they have, and that leads to more damage. But there are conditions which by their own nature are long-term conditions.
Yeah.
For example, if you look at asthma, it's a long-term condition.
Yes.
Patients who have some kinds of bronchitis, like allergic bronchitis, this is a long-term condition. Someone who has special types of pneumonia which are not infectious pneumonias, because we do have pneumonias which are not caused by germs, but are caused by our own immune system fighting us. Now, in those kind of patients, that is a long-term problem, and we may not be able to cure them. So, a patient may end up with a condition which is not curable, but can be managed so that the condition does not affect their life to a large extent.
So check up. Visiting the doctor is important.
Yes.
And remember, dear viewer, you're still receiving your questions on 22232. The lines actually are projected right here at the bottom of your screen. Keep your questions coming. One more viewer writes and says, I have a persistent dry cough and I have taken several antibiotics, but it's not going. So, Daktari, where can I get checkup? But I'm not sick.
Yes.
You know, they have a persistent dry cough. They have taken several antibiotics, but it's not going. But they're not feeling
too sick.
Yeah.
Yeah, I think this illustrates the point we were discussing earlier, that antibiotics are not the only thing that may help in the lung. The key thing is to find out, why is this person coughing every day? Because there are many conditions which may cause one to cough that are not infections. And if one is coughing persistently, we must think of those things. You see things like asthma. If a person has smoked in the past, you're thinking of smoker's cough. It's not an infection. It's just because the airway has been irritated by the smoke.
Yes.
If a person has allergy, it may be due to that. Now, there are conditions in the food pipe which can cause one to cough a lot, and they're not feeling so unwell, like reflux we discussed about.
Yes.
Other conditions in the ear, nose, and throat area can cause one to cough a lot. For instance, there are people with sinuses, and there is mucus coming from the sinuses and dripping into the throat, triggering a cough, what we call postnasal drip. Always coughing, but they are not feeling sick. But we also have some serious infections which may cause a cough without necessarily causing one to feel extremely unwell, like TB. There are people who will have TB for months on end. They will tell me that this cough from November last year, and we are in August, October. That's a whole year. Then you do an X-ray, and lo and behold, this person's lung is destroyed by TB. They never felt bad, but the TB was there. So most of these symptoms need to be assessed, so that even when you are taking antibiotics, it is the right treatment. Rather than take antibiotics, you get frustrated. I've taken 7 courses of antibiotics this year. Now, the other thing, actually one may have an infection, but the antibiotic you're taking is completely unsuitable for treating the infection that you have. For example, I had a patient just last 2 weeks ago.
Yes.
This lady has had a cough from December last year. She's coming in August. She has gone to pharmacies. She's getting the same antibiotics, but from different manufacturers. So she came with all those packets. Packet for January, packet for February, March, April, May, June, July. Each one of them.
Yes.
So I told her, you see this antibiotic, read this name. She read amoxicillin. We picked another one from a different company, different color. Read this, amoxicillin. All of them were amoxicillin. And the type of infection she had was not going to respond to amoxicillin. So it is important to have yourself checked. If especially you've done first aid, it's not working, have someone look at you so that you don't continue suffering unnecessary.
Okay. Because the key thing you've said, a cold, can a cold cause chest infection?
Yes, it can.
Yeah.
Yes, it can.
So if I use my first aid, as you've said, I've tried first aid, it's failed. My first aid is dawa, you know, the common Kenyan.
Common dawa.
So if I've tried dawa, it's not working, I should rush to doctor.
The doctor who is close to you.
Yes.
Because any doctor or any nurse or even a clinical officer, they will be able to tell that this one we can wait. This one needs urgent review by a physician or a specialist, or this one I can treat so that this person gets a better outcome.
Okay. And then how long does chest infection last?
It depends on the type of infection that one has. We've said that there are viral infections, there are bacterial infections, and there are infections like TB and parasites.
Yes.
Virus infections tend to last short. When I say that, I mean that the body tends to clear the viruses quickly. Within a week to 2 weeks, most virus infections have been cleared from the body. But the effects may last long. For instance, as we have seen in patients who have influenza and lately COVID. One of the reporters called Quest 2 years ago said that he got COVID in March or April, and up to January the following year, he was still feeling unwell.
Yes.
So the virus cleared a long time ago, but the effects have persisted for a long time. And unfortunately, what happens if one is not properly educated about the condition, you will go and find that you have chest discomfort.
Yes.
You are told it's a virus infection, for one reason or another, you don't believe it, you buy an antibiotic in March. You go back in April because you're not getting better, you're still feeling tired, can't breathe well, buy another antibiotic, buy another antibiotic. And at the end of the day, whatever was causing trouble cleared a long time ago. Now, bacterial infections tend to linger on for a longer period of time. If a bacterial infection is treated, within a week to 2 weeks, you'd have cleared it, if it is treated with the right antibiotics.
Yeah.
But this also depends on how severe the infection is. If the infection, the pneumonia, is mild, within a few days you are back to yourself. But if it is more severe, you may find although the bacteria was cleared, the person is having symptoms for a long period, 2 to 3 months or even longer. The symptoms will also last long if there are complications of the pneumonia. And complications here mean things like scarring in the lungs, because sometimes the lungs do not heal clean.
Yeah.
They may heal with scars. Sometimes pus may collect either within the lung or in those structures we talked about, the pleura.
Yes.
If pus occurs there, then the healing process will be a bit longer. The bacteria may not be a very hardcore bacteria, but the effect it has caused, like pus collection or damage or death of part of the lung, that may take a bit longer to clear. Now, TB is a special one because TB may stay lingering in your body for a long time, maybe weeks or years even. It's just causing minor symptoms, then you diagnose it, you start treatment. In most cases, symptoms start reducing after the first week, but for most people, they feel well after the end of 2 months. But if there are complications, such as scarring of the lungs, or development of bronchiectasis, that is the airways are distorted, or there's pus collection, now that one will take long. And there are people in whom we may need to give treatment for even 1 year, 2 years, especially when we have drug-resistant tuberculosis. So the outcome of these conditions depends on the causative organism.
Okay. Thank you, Dr. Peter. We have to call it a day here. But before I let you go, I want to give you an opportunity to give us your parting shot in terms of taking care of our chests, which is related to our lungs, and also for those of our viewers who are interested to getting in touch with you. Where can we find you, Dr. Ari?
Okay. So one of the things that we can do to protect ourselves from pneumonias is maintaining a good hygiene, as we discussed, vaccination. There are vaccines which we can use. Everyone is aware about COVID vaccines. Whether they take it or not is another matter altogether. Very, very important. We have influenza vaccines, very, very important. And we do have a third vaccine which protects the lung. We call it streptococcal or pneumococcal vaccine. If one takes these 3 vaccines, as far as lung infections are concerned, you've taken care of maybe 50-60% risk. So that is very, very important.
Okay.
Smoking. Please stop smoking. Stop smoking yourself, stop smoking with your children, stop smoking with your wife or your husband. Smoking changes the way our airway and the lung protects itself. So very, very important. And for those people who are working in dusty or smoky industries, personal protection equipment is very, very important to reduce the risk of pneumonia. Now, for children, vaccines cannot be overemphasized. For the elderly, vaccines cannot be overemphasized. And early diagnosis when one gets exposed or one gets unwell.
Okay.
My office is in Parklands, a block called Doctor's Park. I'm on floor number 5, and that's where we ply our trade of taking care of people's chests.
Okay. Yeah. Doctor's Park at Parklands?
Parklands, third Parklands Avenue, just next to the Aga Khan Hospital.
Okay.
Yeah, third Parklands Avenue.
Thank you. It's called Dr. Peter Munyu, a pulmonologist, helping us discuss the topic on chest infection. I believe you've learned. Please, my take home. And if you go for checkup, it's important. Don't take that cough for granted. It might cost you. It's been a joy to serve you tonight. My name is Grace Mutiso. Have a blessed night. Remember to catch a repeat on this on Facebook and YouTube if you missed. And tomorrow, I believe at around 11 o'clock right here at Hope TV. Have a beautiful night. Stand by for Chiriku and thereafter News Watch at 9 o'clock. Shalom and God bless you.